Hello guys, I welcome you back to my channel. This is Eke Nyami and this is my YouTube channel. So in this video, you'll be talking about Caesarean section. Please note that I am not a health worker. I am just a mom who has gone through 4 Caesarean sections. And with experience and consultations and conversations with doctors and health workers, I thought it wise to do this video because in my part of the world, there were a lot of misconceptions as far as Caesarean section is concerned. And I thought that it would be very great if I do this video. So if you're interested, then kindly stick with me. So what is a Caesarean section? Caesarean section or C-section is just a surgical procedure used to deliver a baby when doctors and health workers see that vaginal delivery is not safe. In my part of the world, most of us call it operation. So I'll either be using operation or I'll either be using C-section in this video. So when doctors have seen that when you give birth through your vagina, it's not be safe for you and your baby, then they can opt for a cesarean section. They can suggest a cesarean section to you. But before you go into a cesarean section, you or your partner or any family member is supposed to sign a consent form that you have given them the chance, you have given them the go ahead to do the cesarean section. So let me talk about my first cesarean section. In fact, my due date was passed. The doctor suggested cesarean section. My husband was supposed to sign, and this man was scared. In fact, we were in the doctor's office for more than 30 minutes. The doctor was trying to explain to us that it is safe and we can do it. And my husband was just scared because he had some misconception about cesarean section. So the doctor told him, gentlemen, when this car that you are using is to crash, the probability that you might get another car is very high. But when you lose this baby or you lose your wife, what is the guarantee that you get another one? And that convinced him to sign. And he, in fact, accepted the fact that he was so scared. But my dear, CS is a safe delivery. What is safe delivery? Safe delivery is when both baby and mother are safe after the whole thing. And so when doctors suggest that you should go through cesarean section, my dear, don't be scared. It is a medical procedure and it is very safe. What are some of the reasons why doctors might suggest cesarean section? These are just a few. When labor isn't progressing normally. So when there's labor, we have the first stage and the second stage. And when doctors and midwives see that the first stage or the second stage are not progressing as it's supposed to be, they might suggest a cesarean section. When the baby is in distress, maybe the baby wants to come through the canal, the baby is not coming, they see that if they don't do the cesarean section, you might lose your baby. The third thing is that when the baby is in an unusual position, and unusual position, normally the baby is supposed to come with the head. But when they see that the baby is trying to come with the legs or the hands or the buttocks, or they call those positions to be breech position. When the baby is in an unusual position, doctors might suggest cesarean section. When there is a problem with the placenta, doctors might suggest cesarean section because when there's a problem with the placenta, that might also result in a severe condition. When there is health condition or health concerns, like maybe the mother has high blood pressure that they think in the process of pushing and all those things, the mother will be at risk. When the mother is diabetic, there are a lot of health conditions. And so when the doctors see that no, this condition or this health concern might result in a serious issue, they might suggest a cesarean section. When you've had a previous C-section, you might or you doctors might suggest your subsequent or your future pregnancies to be delivered through cesarean section. There are other reasons, but I'll stick to these 4 reasons. Now, there are a lot of misconceptions about cesarean section. And the first thing I want to talk about is that, my dear, it is not a case. In my part of the world, when mothers are pregnant, they go to pastors and men of God to pray for them that they should not take them through CS. And when you go to the hospital, the doctor suggests that we might do cesarean section. My dear, mothers start shivering. In fact, I had a friend. She was pregnant. She went to the hospital. They said the baby was in an unusual position. And so when her time is due, she should come so that they do cesarean section. Because of that, this lady refused to go to that hospital because she was trying to run away from the cesarean section. She went to another hospital. They tried to deliver the baby through vaginal birth. In fact, they tried. Finally, the baby came, and the breath of the baby was almost out. They had to take the baby to ICU for 1 month. And after 1 month, now the child is 2 years and the child is not healthy. The child cannot talk, he cannot sit, he cannot walk, he practically always lies down. And I think that if she had given the doctors the consent to go through the cesarean section, this might not have happened. My dear, CS is not a case. It doesn't mean God doesn't love you. It's just a medical procedure. It's just a medical condition that might suggest that you go through a CS. There's another misconception that says that when you go through a CS, you are not a strong woman because you didn't give birth through vagina. You are not a strong woman. My dear, you are strong. You went through 9 months. You went through 9 months pregnancy, throughout the sleepless nights, throughout the nausea, throughout the, in fact, everything you went through. You are strong. And for you to be able to go through cesarean section, my dear, you are strong. The fact that you didn't push through your vagina doesn't mean that you are not strong or you are not a mother. That is a misconception. Then there is another misconception that when you go through CS, you are not strong. Like when you go through CS, you will not be strong again. Let me put it that way. That obey yare yare, your health will not be, my dear. That is not true. That is not true. When everything is okay, when doctors know what they are doing, as I said, I have gone through 4 CS. I am here. I've never visited the hospital again after my CS. I have not had any complications. You just have to you just have to go through the procedure, do everything they tell you to do, and then you'll be fine. So on the day of the CS, I am not a doctor, so I won't go into details, but I know that when they send you to the theater, they will give you anesthesia, which they'll give you an anesthesia, yes, which is an injection into your spine, which will make your lower part numb. So that when they cut, you feel that they are cutting, but you not feel any pain. And then they'll use something to block your view, or another health practitioner will be with you, will be conversing with you while the doctor and the other nurses do the procedure. And all things being equal, I think at most by 45 minutes it should be done and you should see your baby. Now, after it has been done and you've been brought to your hospital bed, there are a few do's and don'ts. So the anesthesia is still in your system, and so you are not supposed to lift your head. When you lift your head, it leaves you with a severe headache after you've been discharged from the hospital. You're not supposed to talk too much because the anesthesia is still in your system. But when at most after 12 hours the anesthesia have weared off, that is when you start feeling the pain. That one I won't lie to you. Everything with birth, whether vaginal birth or cesarean birth, you feel some pain. That is when you start feeling some pain. But doctors will also give you some pain medicine or pain medication to reduce the pain small. So you go through some pain. I would also advise that after the anesthesia have weared off, as much as possible, get off from the bed and then do some small walking. And when you are walking, try to, I know sometimes it's painful, but try to be straight. So because if you always want to be doing this because of the pain, you might come home and you still be walking like that. So don't talk too much, don't lift your head. Try to walk in the hospital, do some small exercises. Your nurses and your doctors will guide you through all those things. And then when you've come home, like, they do not lift things that are heavier than your baby, because you are still going through the healing process. Your wound might heal on the surface, but it takes about 6 weeks for the whole wound to heal. And so don't stress yourself trying to do everything. If possible, get someone to help you. And then I know that 24 hours after the CS, you are not supposed to eat any solid food. So the hospital and the nurses will guide you what to eat and what not to eat. And please take note that you will not have a normal bath up for some time, maybe a couple of weeks. And so you would have to be cleaning your upper body and your lower body, because water is not supposed to go into the surgical area. You are not supposed to let water go to the surgical area. Whatever the nurses and the doctors tell you to do, you do it because you don't want your wound to be infected. And you have to be going to the hospital, I think, every 3 days to dress the wound. And taking care of your wound after CS is very important. If you don't take good care of it and then you get infection, it is also going to be a different problem. But all things being equal, if you avail yourself for the doctors and the nurses to do their work, I am sure that everything is going to be okay. So now let me go to some frequently asked questions. People ask that, can I have a vaginal birth after CS? Yes. 2 years after your CS, you can have a vaginal birth. But for instance, in my case, I did the CS. After 1 year, I got pregnant again. So I wasn't up to the CS. So the doctors had to do it again. After the second one, 9 months, I got pregnant again. And so vaginal birth was not an option for me. But if you are able to do the spacing, yes, you can have a vaginal birth after a CS. The second question is that how many CS am I allowed to have? Ideally, it's three. All things being equal, is three. But when your doctors see that your condition, you can go a fourth one, they can advise you. If you have some conditions that will not allow you to go a third one, they can advise you. But normally it's three. So when I was doing my third one, my doctor told me that on the operation table, he told me that my uterus is healthy. And if I choose to go a fourth one, I can go for a fourth one. So I and my husband decided that we will go a fourth one, which we did. But ideally, it is supposed to be three. Can I breastfeed my baby immediately after SES? Yes, you can. Nurses and then whoever is with you will bring the baby to you. So the baby is supposed to come to the breast. Even if you can't lift your body, they bring the baby to you and then they bring the head of the baby to the breast and you can. It is even advisable that you start as soon as possible so that your body will start producing the breast milk. Can I opt for CS myself? Yes, you can opt for CS yourself, but I advise that you let the doctors do their work. If they think that you can't have a vaginal birth, they will suggest. But if they think that you can, they will allow you to go through the process. So yes, you can opt for CS yourself, but I would suggest that you leave it to the doctors to do their job. So please, my dear, CS is a safe delivery. It is a medical condition. It is not a curse. Don't. Yes, you are supposed to pray. Even if you want to have a vaginal birth, you still have to pray. So don't be going from man of God to man of God to man of God to pray that you don't do CS. Please just put it at the back of your mind that you are safe, you are strong, and you can do this. Please ask me any question you want to ask me in the comment section. And thank you so much for watching this video to the end. Kindly subscribe to my channel if you haven't done that. And please, if you have any other thing you want me to talk about, you can put it in the comment section for me. If I have knowledge about that, I'll talk about it. Kindly subscribe once again and click on the notification button, and I'll see you in the next video. Nyame nka ho.